Welcome to Unstitching ADHD Urban Ed Talks. I'm your host, Dr. Stanley Ekiyor, and I'm honored to introduce today's guest, Dr. Wanda Labrador, who will share a lived experience as an individual with ADHD, a devoted parent with a child with ADHD, and an accomplished educator. Wanda, thank you for joining us, and we sincerely appreciate your willingness to share your journey with ADHD. Please, can you
Thank you.
tell us a little bit about yourself?
Thank you for having me. My name is Wanda Labrador. I am an educator of about over 20 years. More recently, I am actually a director in a district. I have had many different experiences in the classroom, outside of the classroom. I'm also the mother of 5 children who recently finished her doctorate in education, and I'm
Wow.
very, very proud of that. And someone who is living with ADHD and surrounded by people who have ADHD. So I'm excited to talk about how it has impacted me and in my life.
Wow. Thank you very much and congratulations. That's a big accomplishment.
Thank you.
Congrats. So, can you describe for us what it's like living with ADHD from your childhood to adulthood?
So as a child, I wasn't your typical ADHD kid. So I wasn't hyperactive, but I definitely was distracted. I would look out the window, I would daydream a lot. A lot of times I was the one kid that would say, "What are we doing?" when the teacher just gave the instructions. So very typical, kind of being a step behind, but not enough to be noticeable. And plus being a girl, girls are daydreamy, so that's the perception. So definitely nothing that I was aware of or my parents were aware of. As I got older, high school was a little bit harder. I graduated high school as a 16-year-old, so I was actually early graduating, bored with high school, but at the same time wasn't the best student. As I got a little bit older, I think is when I really started noticing that I was very forgetful. I would, back when we would take videotapes back to the store we would rent a videotape, go back to the store the next day. Oftentimes I would get to the store and not have that videotape in my hand, and it was so frustrating. So things like that would happen to me. I'd go into a room and say, "Oh my God, wait, what was I doing?" And very difficult to motivate myself to do things sometimes around the house. So as I got older and had more children, those kinds of things became more frustrating for me. So when I was in my 30s is when I realized I think there's something going on. And by then the internet was a really good source of information. So I looked up my symptoms and realized I think I have ADHD. And that's where my ADHD journey began.
So, when you were growing up with those challenges in the
Hmm.
classroom, being forgetful like you
Hmm.
expressed, what really was the support system that you think helped you to survive the educational setting?
So as a child, I also was very creative. I had a lot of imagination. And I think that that was kind of like a coping skill for me, looking back. Luckily, I had teachers that were very understanding. My first years of school were in Puerto Rico, so I had teachers that were my neighbors, and so it was more of a community feeling. They didn't feel restricted to speak to me or even come to my house if something was going on. So it was a different environment. I think that is what was helpful for me as a younger child. As I got older and got into middle school at once here in the mainland, I guess you can say, it was a little more difficult because more students in the class. I didn't speak the language. I think a lot of times I was described as having a lot of potential. She's very chatty. I would get kicked out of class a lot, especially as I got older in middle, like eighth grade or so. I had teachers that knew already. They had the chair for me right outside the door. So it was a little bit harder to navigate.
How do you describe your journey from when you realized that your child had ADHD?
Mm. So my oldest daughter, I actually have, like I said, I have five children, and out of the five, four are actually diagnosed with ADHD.
Mhm,
My oldest daughter, who is an adult now, she was about 16 years old when she had a lot of depression in her mood. I thought she might even have a mood disorder, but when we finally got a diagnosis, it was ADHD. So a lot of things that come under the umbrella of ADHD were being manifested in her. So learning about ADHD and how it affects someone by being her parent made me look at myself as well. So it made a lot of sense once I started learning and we started going to therapy and we started understanding the effects of ADHD or how it can impact somebody. It made a lot of sense for why my daughter was very impulsive, why she would never let anybody get a word in, why she would go from being extremely joyful and happy, she was a cheerleader, to not wanting to leave her room for days. So all of these things made sense once we had a diagnosis.
mhm,
I even remember the day when she finally went off to college, she decided she wanted to try medication. And so I remember the day that she took her first medication, and I was on my way to work, and she called me and she goes, "Mom, I just took my first pill." And I said, "Oh, okay. How did it go?" She goes, "I can't even explain to you how everything just slowed down." And I said, "What do you mean?" She said, "I felt like I was in a moving car, and now I can focus, like I can see." And this was only a couple of hours into having had her first medication pill, and she already saw the difference. So I remember that very clearly, how joyous she was to feel normal for once, is the way she described it.
right. Let's look at the school environment.
Mhm.
How supportive was the school environment to your child?
So I will use my son as an example
Okay.
because by the time my daughter was diagnosed, she was already almost about to exit high school. So
Mhm,
I still didn't know as much as I wish I had. But with my son, he is 14 years old. He's a ninth grader right now. And ever since he entered school at pre-K, he was always a child who would get into a lot of trouble. He had no spatial awareness. He would truck through a group of kids, bumping kids out of the way. He was never um, ill-intentioned, but he was always getting in trouble. So I already saw that there was something going on. His doctor didn't want to diagnose ADHD until he was at least 5 or 6 years old. So up until then, we were just kind of watching. And then he was finally diagnosed. And in second grade, we started really taking care of the ADHD with medication on top of a therapist and whatnot. How have I advocated? Well, I have always been extremely vocal in telling teachers, like, listen, I know my son, I know how his behavior can impact himself and how it can impact other. I've never been someone who is in denial of his behavior or his issues, but I've been always very upfront. I know what's going on with him. How can we work together? I have always emphasized that we're a team. His doctor, myself, and the teacher, we were always a team. So I always felt like, listen, I'm accountable, but you're accountable. The doctor's accountable. We have to work together. If there was ever anything that he was getting in trouble for or anything that I knew was that ADHD related, I made sure that I would address it so that he wouldn't be the one suffering the consequences. By third grade, I was able to get him a 504 plan so that there were some legal language involved in his education. I knew that us just having that conversation and saying, justice is struggling, my son is struggling, or this is good. Not, I knew that that wasn't enough, that we needed to have some sort of document, some sort of legal document that would hold them accountable and would provide the space so that we can sit down every year and talk about, okay, what are we going to do next year? This is how this year went. What are we going to do next year? So I've just made sure that I use the knowledge that I have about ADHD and about the educational system to advocate for my son and make sure that he's being treated with equity.
So, how receptive was the school to your being involved and your advocacy?
So I think the school, the district that we live in has always been very receptive to I guess, to my guidance because they have always t looked to me before making big decisions about my son. He's had very phenomenal principals, with the exception of middle school. Middle school was a little tougher. I think that the middle school principal that was appointed later, maybe he was a seventh or eighth grader by then, wasn't as understanding. So he did get chastised a lot, got put in school suspension a lot, got kicked out a lot, and that kind of thing, where I think that it was not very much necessary for him to go through all that. But that was an exception. Up until now, almost everybody has been pretty good about it. And they understand that I am an educator and that I know my rights and that I also know what their responsibilities are. So I haven't really had too much trouble, but I can see how if a school is not doing right by the child, how they can see that as a nuisance because they don't want to have to be held accountable. This district, luckily, has been pretty receptive. I'm not going to say they're 100% or that they're perfect in any way, but they at least understand that whatever I'm doing is for the benefit of my son.
Do you think, based on your interaction with staff members, that they are
Mhm.
knowledgeable about ADHD?
Yeah, I think they're somewhat knowledgeable, especially the counselor or the social worker. They're much more knowledgeable. Teachers sometimes need a reminder that some of these things are impulsivity or he's not doing certain things to be mean or disrespectful, that sometimes he can't control some of the things. Now, I can't say that it's all the time, but he has had teachers and he has at least one now that isn't as understanding about the manifestations of ADHD and think that maybe he's doing certain things on purpose. So he manages to get himself in trouble in those classes. However, has no trouble in the classes where the teachers are better prepared and better educated because they know how to deal with his behavior, stimulate him in a way that is productive.
Thank you. What strategies have you found effective in managing ADHD symptoms and maximizing both your potentials and your kids?
So for me and for at least two of my children, I will say acknowledging when medication is warranted, being open to trying the medication and see how it can balance me out, myself and my kids. So that has been really helpful. Me personally, things like visuals, calendars everywhere, calendar on the refrigerator, calendar at work on the wall, calendar on my phone. So those kinds of things keep me focused and keep me more organized. The one on the phone is wonderful because it comes with reminders as well. Um, so that has been really helpful. Things like writing items down, whether it's a shopping list or an experience that I had. So journaling, writing things down has been extremely helpful. And setting, like I said earlier, reminders, but reminders for all kinds of things. So if it's a voice memo or if it's an alarm to remember to look at that note that I wrote myself, sticky notes. God bless whoever created sticky notes because those are wonderful.
Yeah.
And I can say the same thing for my kids. I noticed that those things are also helpful for them.
Not just you alone. You're talking about three kids,
Hmm.
right? I know most people will be wondering, how do you find the balance managing these three aspects of your life?
So, to be honest with you, there's a lot of being mindful of yourself. There's a lot of forgiving yourself and allowing yourself to not be perfect. I find that in my professional life, I tend to be more intentional about being organized, about making sure that I do everything when it's due, things like that. So I work really, really, I mean, it's mentally exhausting, but I get it done. When I come home, especially when my children were younger and I was on my own raising them, there were times when if things didn't get done right now, they just didn't get done. I wasn't gonna be upset with myself because something didn't get done, the laundry didn't get done, as long as my kids were being taken care of, as long as I was having a moment to myself to regroup. So I really think that it's about acknowledging your challenges, looking for your strengths, and kind of building on those and looking for those things that work for you. In my case, I hang my lanyard for work on my rearview mirror every day because seeing it in the morning reminds me that I have to put it on my neck so that I can open my door. If it isn't there, it's a little bit more difficult. So finding those little tiny things that make a huge difference in your life, but most of all, being mindful of yourself and forgiving yourself and giving yourself permission. Those are the things that I think make a huge difference.
Let's now talk about you as an educator. Can you tell us a story of a kid who you had encountered as an educator that had ADHD and where you started and what the outcome was?
So I can remember, especially this one little boy that I had. It was early childhood, so it was about kindergarten. And the first day of school, very first day of school, the mother came to me and said, Miss, my son has problems. And I said to her, what do you mean by that? And she said, oh, he's just like, oh, he's got lots of problems. And I said, okay. I said, I really appreciate you sharing that concern with me. I just met him today, so I just want to make sure that I get to know him. And once I get to know him a little bit better, if I notice anything, then we're going to have conversations. But I appreciate your concern. Of course, I was suspect. I didn't love the fact that this parent greeted me by saying there's something wrong with my son. It made me sad. So, of course, as a parent, it made me sad. But as a teacher, I said, okay, let me keep an eye out, see what's going on. The little boy was lovely. He was beautiful. He was energetic. He was just like every other little boy. Plus, he had a little bit of extra, a little extra umph. So, as a person with ADHD, as a person who has kids with ADHD, I can look at him and say, oh my God, he behaves just like my son. What it did for me was it made me think about ways that I can engage him. So he was my little helper. Oh, somebody has to go to the nurse's office. Why don't you take such and such with you so he can accompany you? Anything that I could do to get him moving and get him to spend that energy, giving him tasks around the classroom, picking up things so that it would kind of be an outlet for him to expend his energy. We would go to the playground a lot. I would encourage him to ride, we had tricycles, ride the tricycles, climb the wall, etc. And the mom oftentimes would come in and ask me how he was doing. And she looked at me kind of side-eyed a little bit when I would say to her, your son is really smart. And it's almost like she was expecting me to say, you're right, there's something wrong with your son. I don't know if maybe it was her first child. I want to say maybe he was her oldest son, so she didn't know uh, what little boys looked like. Maybe someone else came to her and said to her, this little boy, there's something wrong with him. But all I know is that I felt and shared with her all of the time that he was extremely smart, that he was extremely capable, and that he had nothing but potential. And especially as being such a young child, he wasn't even in first grade yet. So I will always remember him. And I can't wait to see him one day. I know he's got to be a teenager because he's about my son's age, and to see how his schooling turned out.
I know inclusion is a big thing for you in your
Mm-hmm.
career.
Mm-hmm.
How would you, if there are teachers out there listening that feel like, you know what, it's not easy to have 20 kids in the classroom and have one that is hyper, it's all over the place. How would you advise that teacher or that administrator to create an inclusive classroom environment for a student like that?
So, first and foremost, I would say whenever you look at a child, if you have your own children, try to look at that child and envision your own child, even if it's for a moment, just to center yourself and say, okay, what would I want my child's teacher or my child's administrator to do right now or to say right now? So, first, put yourself in that place, right? Second of all, understand and acknowledge that not all children, not even kids that have ADHD, learn in the same way. And just because they might have ADHD or present with symptoms of ADHD doesn't mean that they should all be treated the same. So definitely building relationships, looking at what your students, what their strengths are, building on those strengths. I've been someone who believes in restorative practices. I have always felt that, every day is a new day. And you cannot hold a child accountable for what they did yesterday, especially a young child. There's no way. So having a restorative mindset, having a growth mindset, and thinking about how would I want my child to be treated in this situation? How can I help this child learn from the situation that happened, right? But additionally, treating each child as an individual. So if you notice that little Johnny likes sitting on the ground to work on the carpet, let him sit on the carpet. If you see that someone does better by laying down and writing vertically, you know what? Let them do that. The point is, we need to think about some of the rules that we have in our classrooms that are super arbitrary and they don't make any sense to children that are neurodivergent. They need a little bit of a different way. And it's okay if out of 20, 19 are sitting at their desks or in their groups and that one child is on the floor. If that makes them comfortable, let them do the work that way. So let's not be so uptight about having students follow rules, and let's start paying attention to what our kids need. Not what we think they need, but what they really need. And stop making it about us, the adults. It's about the kids.
As an administrator, how do you advocate for understanding and accommodation for individuals with ADHD in your community and school?
So I have, because I do a lot of walkthroughs going into a lot of classrooms and I see a lot of styles, whenever I have noticed that students are not being treated in the way that they should, or they haven't been receiving the accommodations they should, I try to address it. First of all, I address it with the teacher or whoever, if it's a group or if it's a grade level. But for me, the biggest impact has been educating others. So if that means putting together a presentation on practices, then that's what I've done. If that means putting out a newsletter about ADHD, and as a matter of fact, I receive the Attitude magazine newsletters, and I have shared articles from there all of the time when I see that it can help someone in the school. As a matter of fact, I have talked to many parents who have come to have conferences or anything with the teacher, and maybe they know that the child has ADHD and they're afraid to allow them to try medication or something like that. And I usually will give them a testament. I will say, listen, I know it's not for everybody, but let me tell you about my story. So I think by sharing your own story, your own challenges, makes people see you as, okay, this person is not just a teacher or an administrator. This person is a parent. This person is also someone who lives with ADHD. And maybe I should listen. Even if they don't, at least you put your own story out there. And if it didn't help that one parent, it'll help the other. But I have had many conversations with parents where they walk away feeling like they understand it a little better. And then they come back and we talk about it more and more. And I share books and I share articles. And so that's the way that I deal with others, whether it's teachers or parents, and trying to help them with the students that have ADHD.
So, other than you advocating, have you noticed if the school system have trainings, professional learning experiences that is really targeted or ADHD specific for teachers and administrators?
Nope. I will be honest, I haven't seen as much as I'd like to. I think that there's been training surrounding trauma-informed practices, which is wonderful. I've seen a lot of training surrounding restorative practices. I haven't seen as much on ADHD or neurodivergent students because it's almost like that's reserved for practitioners. So if you're a social worker or if you're a counselor or if you're a special ed teacher, then you might get more training or have more opportunities to learn about these things than if you are a mainstream classroom teacher or staff member that does not typically work with students who have disabilities. So it's a little bit of a difficult situation because the practices that we use with children who have ADHD are just good practices. And so it would be really helpful and beneficial to all students if teachers were better educated about it.
Hmm. This has been so insightful. What will be your advice to these different populations
Mhm.
on how to deal with students with ADHD in their schools or classrooms?
So, first of all, our policies have to change surrounding suspensions, and even if it's in school suspensions and exclusionary discipline, that needs to change because from my own perspective, from my own child who was excluded a lot, especially in sixth grade, it seemed to be a really difficult year for him. It doesn't feel good to know that your child is being excluded from the classroom, that they're being put in a room, mind you, like a little baby prison, because maybe they couldn't control their impulses. So we really need to look at how we're dealing with students. How are we helping them to look at their own behavior and their own selves? Because if we're just going to push them out and not really come back and revisit the root of why it is that they're behaving in a certain way, then we're really doing them a disservice. And we're doing ourselves and our other students a disservice too, because it's just a cycle that isn't going to end. But I think that if we are all more inclusive of our students who have ADHD, and that includes talking about it, normalizing the conversations, not demonizing the fact that somebody might be a little bit different or can't walk without bumping into something. That's my story every day. We need to normalize those things so that we are not stigmatizing ADHD. So again, talking about it, bringing more information into the classroom to be shared with everybody, with students, with other teachers, with administrators, perhaps policymakers should come into schools and see how children are being, if there's any accommodations or if there's any kind of practice that is actually being beneficial to our students. ADHD is not a bad word. It's also not a crutch. It's not an excuse. It just means that if somebody knows more about ADHD, they can understand the individual better. That's all.
A parent that has listened to you talking about restorative practices and is dealing with a school right now that is tilting towards some of the challenges you just shared, right? What
Mhm.
would be your advice for a parent like that on how to advocate for their child?
So I would say, first of all, do some Google searches on the legalities surrounding ADHD. It is protected. There's the ADA, Americans with Disabilities Act, that protect children who have differences, and that includes neurodivergence. If somebody is not listening to you, there are advocates in the community who can sit with you and maybe get you prepared to have a conversation or can even come in with you to have a conversation. School districts have a duty to educate all students. That includes kids who have ADHD, right? Among so many others. So it is a legal issue. If nothing else, go and get that 504 plan. How you can get a 504 plan started is by calling the school, speaking to the social worker or to a counselor, or even the nurse sometimes can help, because ADHD is a medical issue. And a 504 plan will protect the child and will create a plan that will take into account what the manifestation is for that child. So, reaching out to the school, getting that 504 plan started, talking to community, look for a support group, possibly even on Facebook or on the different platforms, there might be a support group, but don't suffer in silence. Don't let somebody abuse your child, meaning put your child out of school or not treat them with equity just because they have ADHD. That's not fair. So there are many ways that we can get educated and advocate for ourselves. And again, if you yourself don't know where to start, start by doing a simple search online and connecting with someone that can advocate for you.
Great. Thank you, Dr. Wanda Labrador, for your
Thank you.
willingness to share your journey, expertise, and insights on ADHD in your personal life, raising kids with ADHD, and in our educational system. Your advice will undoubtedly benefit educators that are listening, parents, and students alike. We hope you'll be able to join us next time for more enlightening discussions. But before we wrap it, I want to know, is there any project you're working on?
Sure. So I am currently working on advocating for children who actually have parents who are incarcerated. That is what my topic was for my dissertation, and I did research on it. And this is another group of children who oftentimes suffer a lot of consequences. As a matter of fact, the research shows that many children who have incarcerated parents do end up getting diagnosed with ADHD. So there is a little bit of a connection there too. So that is what I'm working on right now, trying to educate people on whatever I can at the time.
Thank you. As we wrap up today's discussions, we want to extend a special invitation to our valued listeners. Your participation is not just welcome, it's crucial. By subscribing, sharing, and joining our community, you are helping us to unravel the complexities of ADHD. Thank you for tuning in.